conference hall and web room. Most welcome. As you are aware that DARPG and NCGG are jointly conducting National Good Governance webinars, and purpose of webinars is to highlight and disseminate the best practices and sharing of experience of the award-winning institutions to facilitate replication by other state and district governance. As you are aware that 17th webinars have already been conducted since April 2022 as per Prime Minister's instructions. And these webinars were conducted in various themes like improving public service delivery, health, aspirational district programs, etc. Now, in this 18th webinar, which is being held today, theme of this webinar is Swasth Bharat through Ayushman Bharat, Health and Wellness Center. In this webinar, 2 districts are going to participate, which are awarded PM Awards for year 2022 under Bharat. And today, one of the speakers is Latur district of Maharashtra, and another is Ankapalli district of Andhra Pradesh. So first we will start with Latur district. The initiative of Latur district will be presented by Sri Prithvi Raj BP, the then district collector of Latur district, currently CEO of Nagpur Smart and Sustainable City Development Corporation Limited. He is an IS officer of 2014 batch of Maharashtra cadre and holds a BTech degree from IIT Bombay and MBA from IIM Ahmedabad. He has served as Assistant Secretary in Ministry of Coal, Government of India as Sub-Divisional Magistrate and Project Officer for an Integrated Tribal Development Project in Bhandara district of Maharashtra. He has also worked as CEO at Parbhani Jila Parishad and District Magistrate and Collector Latur district of Maharashtra. Now joined as CEO Nagpur Smart and Sustainable City Development Corporation Limited. His study is focused, his work is related to district administration of Latur district under Ayushman Bharat, resulted 3 times increase in full operational health and wellness centers in the district. Our second speaker is from Ankapalli district. The initiative in Ankapalli district will be presented by Sri Ravi Pattan Shetty, Collector and District Magistrate of Ankapalli district, an IAS officer of 2013 batch of. He holds a Bachelor of Engineering degree in Electronics and Telecommunication from Pune University. He has worked as Sub-Collector, Sub-Divisional Magistrate in Ram Pancho Daviram, Project Officer, Integrated Tribal Development Agency, Paderu, CEO NTR, Vidya Sheva, Joint Collector and Additional Magistrate, Kurnool District, and CEO, Andhra Pradesh Center for Financial Systems and Services and Additional Secretary, Finance, Government of Andhra Pradesh. Prior to joining the IAS, he worked the Infosys and also served in Indian Corporate Law Service. District Administration of Ankapalli had set up 576 functional health and wellness center in the district. So now we will listen to both of the speakers. First, I would like to invite Mr. Prithvi Raj BP for his presentation.
Thank you, sir. Sir, am I audible?
Yes, Prithvi, just before you start, we want to show a movie, whatever work you people have done. So I would request to play movie. Santosh ji, we are going to play or?
महाराष्ट्र के लातूर जिले के ग्रामीण क्षेत्रों में हेल्थ एंड वेलनेस सेंटर ने स्वास्थ्य सेवाओं की बदली है तस्वीर।
आयुष्मान भारत के हेल्थ एंड वेलनेस सेंटर के द्वारा हम सभी एक्सटेंडेड सर्विसेज तो दे ही रहे हैं, साथ में एक हेल्दी विलेज किस तरह से बनाया जाए, एक हेल्दी कम्युनिटी किस तरह से बनाई जाए, इसके बारे में भी हम प्रयत्न कर रहे हैं। प्राइवेट सेक्टर में लोग जिसके लिए जाया करते थे, तो वो सारी सर्विसेज अब हमने हेल्थ एंड वेलनेस सेंटर्स के माध्यम से हमने देना शुरू कर दिया है। गाँव में जो प्रिवेंटिव एस्पेक्ट है मेडिसिन का, जिसपे पहले इतना फोकस नहीं होता था लेकिन अब फोकस होने लगा है, तो उसके द्वारा हमने वेलनेस एक्टिविटीज़, योगा की एक्टिविटीज़ और एक हेल्दी लाइफस्टाइल कैसे जिया जाए, तो उसके बारे में गाँव में काफ़ी हमने कैंप्स रखे, लोगों को इसके बारे में इंफॉर्मेशन दिया और इसमें काफ़ी हद तक हमें इसमें सक्सेस भी मिला।
ये सेंटर्स गांव के काफी नजदीक हैं, जिससे गांव वालों का यहां पहुंचना तो सुगम हुआ ही है, साथ ही उन्हें अच्छी स्वास्थ्य सेवाएं गांव के आसपास ही मिल रही हैं।
आयुष्मान भारत से हम जैसे गांव को लोगों को हर 5 किलोमीटर पर एक डॉक्टर मिला।
डोर स्टेप अप्रोच हमने रखा कि हमारे जो हेल्थ फैसिलिटी प्रोवाइडर हैं वो गांव में लोगों के घर तक जाएंगे, वहां उनका स्क्रीनिंग करेंगे, एक तरह से उनका विश्वास जीतेंगे ताकि उन लोगों को ट्रीटमेंट पे भरोसा आए। अगर कोई पेशेंट है, सीरियस पेशेंट है, तो उनका पैलिएटिव केयर का वो लोग ध्यान रखते हैं, फॉलो अप मेडिसिन वहां पे हो रही हैं कि नहीं वो कर रहे हैं। टेली कंसल्टेशन के द्वारा हमने लगभग 3.25 लाख लोगों को टेली कंसल्टेशन का फायदा दिया है, तो इसमें उनका ट्रैवलिंग का टाइम भी बचा है और जो स्पेशलाइज्ड ट्रीटमेंट है वो उनको सब सेंटर पीएचसी लेवल पे हमने अवेलेबल करके दिया है।
आयुष्मान कार्ड के माध्यम से स्वास्थ्य बीमा का लाभ जरूरतमंद तक पहुंचे, इसके लिए भी ये सेंटर्स महत्वपूर्ण भूमिका निभा रहे हैं।
जो इंश्योरेंस पार्ट है उसमें भी लातूर जिले में जो हमारे हेल्थ एंड वेलनेस सेंटर्स हैं उनमें हमने कई प्रकार के कैंप लिए हैं और उन कैंप के जरिए हमने जो लाभार्थी हैं उन लोगों को हमने आयुष्मान कार्ड दिया गया है। इस आयुष्मान कार्ड से जो भी एम्पैनल्ड हॉस्पिटल्स हैं, प्राइवेट हॉस्पिटल्स हैं, गवर्नमेंट हॉस्पिटल्स हैं, जहाँ पे उन्हें और थोड़ा स्पेशलाइज्ड ट्रीटमेंट की आवश्यकता है, तो वहाँ पे वो कार्ड का उपयोग कर सकते हैं और वहाँ पे उन्हें निःशुल्क उसका ट्रीटमेंट होगा।
आयुष्मान भारत योजना की वजह से मेरा इलाज मुफ्त हुआ।
आयुष्मान भारत की वजह से मुझे मेरी गर्भावस्था के दौरान सभी सेवाएं मिली और प्रसव के बाद भी सभी सुविधाएं मुफ्त मिली। मेरे बच्चे के सभी टीकाकरण भी पूरे हो गए हैं।
पिछले 3 साल में हमारा जो ओपीडी का फुटफॉल है वो काफ़ी ज़्यादा इंक्रीज हुआ है, तो इससे ये क्लियर है कि हमारे जो ग्रामीण भाग के लोग हैं उनको कॉन्फिडेंस आया है गवर्नमेंट की हेल्थ केयर फैसिलिटी पे। हम सारी सर्विसेज सभी जगह क्वालिटी ट्रीटमेंट हम प्रोवाइड करवा रहे हैं और जो एक मुख्य एम है कि लोगों का जो आउट ऑफ पॉकेट एक्सपेंडिचर है हेल्थ में वो कम होना चाहिए, तो वो काफ़ी हद तक लातूर जिले में वी हैव बीन सक्सेसफुल।
अभी किसी के सामने हाथ फैलाने की जरूरत नहीं है।
महाराष्ट्र के लातूर जिले के ग्रामीण इलाकों में गुणवत्तापूर्ण स्वास्थ्य सेवा प्रदान करने के लिए हेल्थ एंड वेलनेस सेंटर का प्रयास प्रशंसनीय है।
Now I request the next movie. Okay, let us see next movie which is related to second initiative. Just play.
आंध्र प्रदेश के अनाकापल्ली जिले में हेल्थ एंड वेलनेस सेंटर के माध्यम से नागरिकों को दी जा रही है सेहत की सौगात।
In Anakapalli district, we have been implementing Ayushman Bharat scheme. Under Ayushman Bharat scheme, we have 576 health and wellness centers in Anakapalli districts. Through these health and wellness centers, we are ensuring a continuum of care is delivered at grassroots level. Anakapalli district is mostly a rural district where 80% population resides in rural areas. Our challenges were access, good availability of healthcare services, availability of doctors, and affordability. These are the major challenges in Anakapalli district. Every health and wellness center is at a village level, at a mandal level, and at the division level. We ensure that our teams help them, handhold them, and guide them much better, and ensure that they are implementing the scheme in the true spirit and as per the guidelines.
Yoga, meditation, and other wellness practices are given more emphasis. Also, the database which has been collected, it has been incorporated into the ABHA card, which makes it much more easier for the doctor to follow up the care of treatment which has been provided anywhere in our country.
Our institutional delivery today is 100%. We are able to bring out a lot of women, pregnant and adolescent girls, out of anemia through these health and wellness centers. Because of the health and wellness centers, we could ensure NCD management at the village level. We have ensured proper diagnosis. After they are diagnosed, we are ensuring proper intervention, and these interventions are being followed up on a regular basis. Overall, we can see our sustainable development goal indicators have improved in Ankaapalli district.
For the common man, Ayushman Bharat scheme is a boon. He is able to access proper healthcare, free of cost treatment at his doorstep. I am able to visit the household of an underprivileged person once in a fortnight in order to follow up his medical condition and also ensure that his lifestyle is modified so as to prevent him from further progressing his disease.
आयुष्मान भारत स्कीम द्वारा
मेरी पहली डिलीवरी एक प्राइवेट हॉस्पिटल में हुई थी, जिसमें हमारा काफी खर्चा आया था, लेकिन आयुष्मान भारत की वजह से मेरी दूसरी डिलीवरी फ्री में हुई है और मेरा इलाज भी काफी अच्छा हुआ है। आयुष्मान भारत की वजह से आज हम बहुत खुश हैं।
आयुष्मान कार्ड की वजह से आज मेरी जान बच पाई।
आयुष्मान भारत की वजह से अब मुझे हॉस्पिटल के बिल्स की चिंता नहीं है।
We would like to realize the dream of Swasth Ankaapalli, Swasth Andhra Pradesh, in turn Swasth Bharat.
आंध्र प्रदेश के अनाकापल्ली जिले द्वारा हेल्थ एंड वेलनेस सेंटर के जरिए स्वास्थ्य संबंधी सुविधाओं को ग्रामीण इलाकों में पहुंचाने का किया जा रहा सफल प्रयास प्रशंसनीय है।
Now, I would like to invite our first speaker, Sri Prithviraj BPG.
Thank you, sir. Sir, am I audible?
Yeah, you are very much audible.
Thank you, sir. Firstly, I would like to thank DRPG for giving me the opportunity to present the work that we have done in Latur district in the health sector. Good afternoon to everyone. I would briefly take around 15 to 20 minutes to explain the initiatives that we have taken in Latur district. Just to start with the background of Latur, Latur district is located in Marathwada region of Maharashtra. It is a drought-prone area district where DPAP program is undertaken. Also, the Human Development Index, if you look at it, so that is around 0.6. So it's one of the lowest districts in terms of HDI in Maharashtra. Can I request the presenter to put on the PPT also? Thank you. So if we can go to the first slide. Yeah, next slide, please. Right. So as I was saying, there is a critical and urgent need of providing better healthcare services in district like Latur. Everyone must be aware that there are three levels of healthcare system that we have implemented in India. One is the PHC level, which is at the sub-center. Sorry, first is the sub-center, which is basically to provide the primary health care. Then we have the secondary setup, which includes sub-district hospital. And then the tertiary healthcare system, which is basically the district civil hospital or the government medical colleges in many of the districts. So these have been divided so that as per the need of the patient and as per the criticality of the disease, he is being treated at the appropriate level. Now, what has been happening is at the primary healthcare level, a very limited set of services were being provided. And that's why a lot of people were preferring to go to either private hospitals or they were going to the tertiary healthcare systems directly. So under Ayushman Bharat, one of the objectives was to provide a comprehensive, expanded primary healthcare services, which will not just include the curative aspect, but also the preventive, promotive, rehabilitative, and the palliative cares, especially in the older people. As everyone is aware, in India now 60% mortality is basically due to non-communicable diseases. So there is a transition which is happening in terms of diseases in our country, and we need to focus our efforts on these NCD diseases, which basically include diabetes, then you have blood pressure, cancer, and other such diseases. So this was the background, and this being the objective of Ayushman Bharat, we started in Latur with certain initiatives. Can we go to the next slide, please? Right. So there are basically 5 steps in operationalization of health and wellness center. The one is, of course, the infrastructure and proper branding, ensuring that minimum facilities are available in the building. Second is the manpower. Proper recruitment needs to happen along with their capacity building and training. So this was the second point. The third one is that diagnostic services. So earlier diagnostic services which were available were very limited. But after the operationalization of Ayushman Bharat Health and Wellness Centers, so we have been able to provide 14 diagnostic tests at the sub-center level and 64 at the PHC level. Similarly, the medicines availability also has been increased. Earlier, it was very less. Now it is 91 medicines are available free of cost at sub-center and 124 medicines available at the PHC level. And the final stage is to provide teleconsultation facility. This is very important because earlier, even for small diseases, small afflictions, people used to go to tertiary healthcare hospitals. So, and then there was a problem of congestion of tertiary medical facilities, and the appropriate patients were not getting the appropriate healthcare because of the congestion. So by implementing teleconsultation facility, even at the sub-center level, the expert advice can be obtained for the patient. So in this regard, we also implemented the teleconsultation facility at all the sub-centers in our district. So this chart basically shows that we have around 46 PHCs in Latur and 187 sub-centers in Latur, and 100% conversion of these facilities into health and wellness centers was achieved. Next slide, please. So what was the result of operationalization of health and wellness centers? So if you look at first chart, this is the number of the OPD patients who have visited the health and wellness centers. So if you see, there has been a gradual increase. The last number which is there for 22-23, it's till December 22, but later on the updated figure for March 23. So the cumulative OPD care that we have been able to provide in Latur has crossed 50 lakhs in the last 3 years. Now this is a significant number. The reason I'm saying is the total population of Latur is around 26 lakh people. So in order to provide, so having provided so much OPD facilities, we can claim that number one, the out-of-pocket expenditure in the private hospitals, which people used to incur earlier, has definitely reduced. Number two, the congestion at the tertiary facilities like the district hospital, medical college at the district headquarters, they have reduced, and only the critical and the serious patients who are appropriate for going to the tertiary facilities, that has been achieved. Also, the trust, the most important thing is people have started trusting the government facilities at the sub-center level. Now, earlier the first thought used to be that let's go to the private hospital and let's show the patient in the private setup. But now that has changed because at a relatively close distance from the village, as you all are aware, sub-center caters to around 4,000 to 5,000 people population. So at approximately 4 to 5 kilometer distance, they are able to get comprehensive services primary health services. And even for certain serious diseases, they are able to get the teleconsultation facility. On top of that, they are getting the diagnostics done free of cost. Plus, the medicines are also given free of cost. And a follow-up system through our ANMs and ASHA workers at the village level. So that is also happening. So in the entire picture, now the trust of the people in the government health institutes has increased. The second table, if you look at the slide, it basically shows the drive that we took for the NCD diseases. So out of the total population of Latur, approximately 10 lakh population was the eligible population, in the sense that they were more than 30 years of age, and they were 100% screened for the NCD disease like hypertension and diabetes. So out of that, we found that diagnosed were around 41,000 for hypertension, 20,000 for diabetes, and then free medicines, diabetes medicine, blood pressure medicines, these were given to the patients, and also a regular follow-up. Whenever the medical officer used to visit, every Thursday he goes to the sub-center. So he takes a follow-up of all the patients who are undergoing NCD treatment. So this way, an entire chain of follow-up and supervision mechanism has been there, and people are giving good response to it. Can we go to the next slide, please? So these are the extensive, expandable services that we are giving. But at the same time, we found that the regular services, which were earlier being given through the PHCs and sub-centers, which were basically RCH services, reproductive and child health services. So there was a positive impact on those routine activities also. So for example, if we see the registration, ANC registration has increased, fully immunized children, fully protected ANCs, that number has also increased. So there is a spillover effect of, by providing these extra services through health and wellness centers, the routine services, they have also improved. In fact, Latur got the first rank in terms of the surveillance, which was done through integrated disease surveillance program. That's shown in the second table. Next slide, please. So this basically shows that overall, all the indicators have been improved after the operationalization of health and wellness centers. Next slide, please. So just to dwell on what all other services we have given apart from NCD. So one is eye care, like basic Snell test, those vision chart, that also we have given at all the health and wellness centers, and basic eye testing is being done. Second, we have also started in some selected facilities, Man Shakti Clinic. These are basically, Maharashtra and a lot of other Latur and other agrarian districts are facing these problems of farmer suicide and other social issues. So there are cases of depression, there are cases of addiction, especially in the rural areas. So we try to target those issues with the help of these Man Shakti Clinic. It's a limited exercise that we did. But if we look at the numbers, we were able to identify 2,000 cases, 2,000 plus cases of depression, and approximately 5,000 cases of addiction. And then we were also, the follow-up was done by the doctors, and basic medicines which are there that have been provided. So it's a small start, but the point is that we can give a lot of services once this basic infrastructure of health and wellness center is established. Lot of new services can be provided, and this is just an example. Another thing I would like to mention is that we have started an Institute of Autism and Multidisability Center called Umang in Latur. And this is a PPP based model. So what we are doing through health and wellness centers is filtering the students. So whenever a RBSK team goes and we find that there is some issue, autism or any other issue with one of the child, then we filter it through the health and wellness center, and those patients they are sent to Umang, where they are being treated. Now, Umang is a separate thing, but the point is that HWC is helping us in filtering those cases and sending appropriate cases to Umang for further treatment. Another initiative that we took in Latur district was for the elderly people. So in Marathi, we called the campaign as Thode se Mai Bapa Sati Pan. something for the elderly people. So we arranged health camps in all the village, most of the villages, and the basic checkup, basic diagnostics was done, and the basic medicines were given to them. Also some referral which was required, so that was also being done. ENT care also basic we are providing through Health and Wellness Center. So again, I would like to reiterate that we can build upon a lot of things once we have the basic infrastructure of Health and Wellness Center established. I will also dwell upon one of the initiative which we undertook for the detection of cancer patients. Can we go on to the next slide, please? Right. So what were the things which helped us in operationalizing HWC in a proper manner? So firstly, obviously the recruitment of the manpower, their proper training, and also in NHM, we all know that incentive-based salary is there. So timely incentives were given based on their work which was done. So there was absolutely no issues in terms of delay or anything, and regularly incentives were given, which motivated the health staff also to work as per the directions. IT services, diagnostics and drugs, these were made available at all the centers. So for this, if the NHM fund was not sufficient, we pulled in through the district level fund, which is under the district collector, which is known as District Planning and Development Fund. So this was done for the entire year. As everyone is aware, after COVID, there was a lot of focus on health. So we were able to convince the public representatives, and they also agreed with us, and we were able to provide a lot of funds in the health sector. Also, we were able to purchase almost 40 to 50 ambulances through the 15th Finance Commission funds. And also we were able to convince the local MPs and MLAs. So they have their MP LAD scheme and MLA LAD scheme. So through that also, they supported us by purchasing ambulances for our health and wellness centers. So when we are doing when we are providing the treatment, there is also the question of quality, whether are we providing quality treatment or not. So what we did was we went for the quality assessment as well. So if we look at the last 2 points in the slide, there is the National Quality Assessment Survey, and there is one similar quality assessment survey called Kaya Kalp, which is at the Maharashtra state level. So in 21-22, if we see the maximum number of sub-centers, health and wellness center sub-centers, they were selected in the state. Even at the national level, 5 of our PHCs, they got accredited in NQS, and 9 PHCs, they had proceeded to the last round. So the point I'm trying to make is we also ensured that the quality is maintained while giving these comprehensive range of services. Next slide. Right. So this is probably the last slide. So in this, I would like to dwell on Sanjeevani Abhiyan. So this was a campaign which we did for the detection of breast and cervical cancer in Latur district. As everyone is aware that these two cancers are kind of ignored most at the rural level, and especially in agrarian districts and backward districts. People don't usually come forward easily. Ladies especially do not come forward easily to get themselves checked for breast cancer and cervical cancer. So we involved the health and wellness centers. We had a special training done by our staff, by our people, and also the private doctors, private association, IMA and the Gynecologist Association, they were actively involved in it. So we provided the basic training to the doctors and the MOs at sub-center level, so they can do the basic test. And once the basic test is done, then for referral, obviously biopsy and further advanced test, they were being referred to the district medical college and also some of the private hospitals. So approximately 3.5 lakh women were screened through this. So this also involved questionnaire, like there was a set of questions which was being asked to ladies, and based on that, they were also being called to health and wellness centers. Then there are some tests like VI test is there, and other screening tests are there. So they were done at the health and wellness center level, and further referral was also made. So this was a novel initiative which a lot of appreciation was given in the state as well. And even the Regional Cancer Institute, which is there in Aurangabad, they also got involved in this. So at the time when I left the post of district collector, I got transferred 3 months back. So some of the patients we had sent to the regional cancer institute also for treatment, and for some others, the medicines and other treatment was going on. So this was also done again to emphasize the fact that the health and wellness center basic infrastructure, we were trying to use it in novel ways. In what all different ways can we use it? And through the Sanjeevani Abhiyan, through the autism center, which is Umang, and the other initiatives, we were able to get a lot of benefit from this health and wellness centers. Thank you.
Thank you, Sri Prithviraj ji, for this wonderful presentation. How you have put your all effort to improve services of health and wellness center in Latur district. We will come back to you again during question answer sessions. Now, I would like to invite our second speaker, Sri Ravi Pattan Setti, Collector and District Magistrate of Ankampalli, for his presentation. Mr. Ravi Pattan Setti.
Good afternoon, sir. Sir, am I audible, sir?
Yeah, you are audible. Please.
Can I request the presentation to be uploaded, please? Good afternoon, sir. Good afternoon to all. Ankampalli district, basically the motto was we wanted to promote Swasth Bharat, Swasth Ankampalli through health and wellness centers. Idea is we have to ensure that all of them have to start thinking about health and wellness at the same time. Can you go to the next slide, please? Just in brief, sir, Ankampalli, the major challenges before Ankampalli district were basically the access, the issue of access, where the closest, you can see the big hospital was around 100 kilometers on an average from every health and wellness center point. The availability of doctors was not as per the required standard. Since this was mostly a rural population, so the awareness levels amongst the rural population about mainly NCD, non-communicable diseases, was not good, and also the anemia level in our district was very high. So these were the major challenges for Ankampalli district. If we see the infrastructure that was created under this program, and which was also the earlier infrastructure which was upgraded, we in total had 45 PHCs. We also have a concept of urban health clinics, which are 9 of them, and we have 522 health and wellness centers, which are at the village level and the ward level. So this is basically the upgrading of the sub-centers as a health and wellness centers. Next slide, please. This is a small video. Basically, we had created, but if we have time, we can just...
Under the Ayushman Bharat initiative, Ankampalli district is strengthening primary healthcare services by setting up health and wellness centers. Previously, we used to provide services at primary health centers and sub-centers where people used to come and get treated for their illnesses. There was a lack of follow-up, but after the great initiative of Pradhan Mantri Ayushman Bharat Health and Wellness Center in our country, we are providing all these services by ensuring continuum of care, team-based approach, reaching up to the last mile. When we talk about health and wellness centers, our intention is not only about curing a disease, but also in preventing it by promoting health and wellness activities in the form of lifestyle modification, activities like yoga and aerobics, counseling for healthy and nutritious diet. We provide RCH services such as antenatal checkups, identification and management of risk pregnancy, postnatal counseling, and child immunization services. As a part of the family physician concept, medical officers will be visiting bedridden patients at home and provide palliative care to the old, and will provide regular follow-up until cure is achieved.
Next slide, please. So in this
Ayushman Bharat initiative,
No, next slide. So in this slide, in the earlier video, we tried to capture the activities done at health and wellness centers on day-to-day basis. Sir, if we see that health and wellness center, earlier we used to look at healthcare from the point of view of ensuring the population is disease-free, or there are no, there is a lack, if any person comes with certain kind of illness, we used to give them some form of treatment. But now these health and wellness centers, because the word wellness has been added, they are more comprehensive in nature. So under this health and wellness center, sir, we are ensuring last mile service delivery, because we have 522 delivery points, sir. So we are ensuring round the clock emergency services through all these 522 health and wellness centers, sir. We are also expanding our HR, sir. Basically, under health and wellness centers, we got a post called as community health officer. So the community health officer, being a BSc graduate, along with the existing A&M and the ASHA worker, they have strengthened the health services delivery at the village level, sir. We have also ensured that because in Anakapalli district and in the state of Andhra Pradesh, the SHG movement was very strong. So we have around 46,000 self-help groups. So we have ensured that their participation, the SHG women participation in delivering comprehensive health services, is also tapped into. The one more additional point which we would like to stress is our usage of IT systems, sir, basically for monitoring and reviewing the day-to-day health services delivery, sir. Basically, if we consider say like anemia percentage in a specific secretariat or in a specific taluka place, we could narrow down on the focus areas because of the robust IT systems which have been built during the implementation of this program. And the other points, like because of health and wellness centers, we can now deliver 14 type of diagnostic tests at the village level, sir. And now this is 104 drugs at the village level, sir. So all this has ensured that at the village level itself, we can deliver comprehensive healthcare services along with wellness activities. Next slide. So just to bring about the facts which were done during the time of presentation, was we could deliver holistic health services to all 30 plus populations, sir. We could screen the 100% population which was suspected for hypertension and 99% for diabetes, sir. All the screened were narrowed down who required follow-up care, and we found out that 75,698 people require follow-up. All the 576 health and wellness centers were made functional, sir. And one parameter, how did we ensure that they are functional, is counting the footfall at these health and wellness centers, sir. We linked each and every health and wellness centers to the telemedicine hub, so they could coordinate with the PHC and the telemedicine hub at the district hospital level. We have ensured that we complete testing for all the anemic cases. So we identified 34,596 anemic cases, and we could ensure targeted intervention and bring 7% out of them out of anemia, sir. Sir, prior to health and wellness centers, sir, some 124 habitations of ours still lacked good access for institutional delivery, but we could ensure 100% institutional delivery through these health and wellness centers. Next. So one thing which we could understand at the health and wellness center level is understanding SDG, Sustainable Development Indicators, health indicators, basically at health and wellness centers, sir. So we basically took 8 indicators and then captured each and every indicator at the health and wellness center level, sir. So, for example, sir, we understood what is our PMMY-VY coverage, beneficiary coverage. What is the percentage of anemic pregnant women at the health and wellness center, sir? What is the number of adolescent girls who are anemic at the village and health center, sir? So, like this, we could trace each and every village and health center performance and then monitor it over a timeline of 3 months each. And currently, sir, this number is for the last year, sir, but we have achieved almost a very good improvement in our MMR. Our MMR is almost nearing 0, sir. Our immunization is 100%, sir, now. Our IMR has reduced to 7%, sir. We have also ensured our anemic adolescent has reduced by 3%, sir, and our pregnant and lactating women has reduced by 24%, sir. The data has to be updated, sir, but this is our reduction that we could observe because of the health and wellness centers continuous monitoring and giving them very targeted indicators which they have to monitor at the village level. Next. So what is that we could do is because of we could introduce some best practices, and one of the best practices which I would like to talk in a little detail is the concept of family physician, sir. So what is the concept of family physician is, sir? Now these 522 health and wellness centers are basically staffed with a nursing graduate and a A&M. But along with that, in a month, we could ensure twice an MBBS doctor visits the 522 village and health and wellness centers. So for example, we have 45 PHCs, sir. Every PHC has 2 MBBS doctors. 1 MBBS doctor is placed at the hospital and 1 MBBS doctor visits this health and wellness center. He conducts a health and wellness center camp, which is known as a FDP camp, Family Physician Doctor Camp. And during this camp, they do all the activities, they undertake all the activities which are taken up by an A&M on day-to-day basis. For example, they will identify the number of students who are adolescent girls who are anemic. What is the follow-up being done for them? They will identify whether there are any bottlenecks or any drawbacks in the follow-up, and then they will ensure that they are rectified. So all the indicators are taken up at this camp, which is done by a doctor for each and every village, MBBS doctor for each and every village. So the interaction between the patients who require services is reduced greatly. So this directly also reduces the out-of-pocket expenses, because earlier a person, if they have to meet a doctor, they have to travel to PHC, which is again some transportation expenses and out-of-pocket expenses that has to be incurred. But now the doctor themselves are visiting the villages through this family physician concept, and they're conducting camps, which is conducted twice in a month in every village, in every health and wellness center. So this increases, this reduces the out-of-pocket expenditure. This ensures quality, the quality of health services delivery is improved multiple folds, sir, at the health and wellness center. So now what has happened, sir, our NCD follow-up is improved drastically. Our anemia follow-up has increased drastically. Our SDG indicators are monitored much better because of the much better supervision and the visits of MBBS doctor at this health and wellness center, sir. So this is something which I would like to stress, sir. Every day we are conducting camps in every village, sir. We are having around 39 camps every day, sir. And these 39 camps are conducted around the clock except on the day of holidays, and they are conducted by MBBS doctors, sir. So at these camps, we expect a footfall of around 200 to 250, sir. And all these people are screened again. The 14 diagnostic tests, all are followed up, sir. And if there are any referral cases, they are identified and they are referred to the tertiary hospital where the further care is taken up, sir. So this is something which is one of the best practices and which has been done in the state of Andhra Pradesh. But in Anakapalli district, we could strengthen it to a great extent, sir. And we have ensured that the NCD management has improved drastically, sir. Second is our ABA ID generation was also very good, sir. So we could use a lot of the data that was generated, and we could link a lot of data for improving our monitoring and supervision, sir. And also, sir, our teleconsultation hub, right, as I told earlier, sir, we had health and wellness centers personnel being trained how to use teleconsultation services. So we could strengthen our teleconsultation hub, and we could see that we are receiving on an average 3,000 plus calls on a single day or working day, where teleconsultation services are given through these teleconsultation hubs and these PHCs. So these best practices have ensured that the comprehensive service delivery has improved much more at the village level, and this in turn has reduced the out-of-pocket expenses and the travel time and the other issues which earlier our village people used to face, that has reduced drastically. Next. Sir, when we now are, when we are already focusing on family physician concept, and when we are already focusing on health and wellness center, we try to chart a way out. How do we take it ahead from this? as my colleague earlier has told, sir, health and wellness center basically build a basic quality infrastructure at the village level, and there is a lot of opportunity for the district administration and the health department to ensure that this infrastructure is utilized for delivery of all the services. So now, as sir as Prithviraj ji has already done, we have also started cancer screening in our district through this health and wellness center, sir. We are ensuring right intervention can be delivered at the right time. Like, for example, sir, our DAIC center has become more active because of health and wellness center, sir. As the school screening are being done by MBBS doctors through these health and wellness centers, sir, the interventions are more targeted, and we want to make it further more targeted because of this, sir. Finally, sir, if we see that if we do NCD management properly and if we ensure that the proper care is delivered at the primary center or the health and wellness center itself, the load on the tertiary hospitals can be drastically reduced. In turn, the cost to the exchequer also can be reduced. So that is one area which we are continuously focused on. One more important point is, sir, we are now deploying our specialists through this data and that has been generated through this day-to-day monitoring. For example, sir, earlier we used to deploy pediatric surgeons all over the district, but now we could understand the area where pediatricians are required more in number, and where that area requires more focus. So where the gynecologists are required more. So we could properly ensure that the specialists which are few in number, sir, which are limited resource personnel. So how do we ensure maximum utilization and ensure that the quality of service delivery is more in that area? So that could be done because of a lot of the data that has been generated through the reviews and through using ABID, and we could ensure targeted service delivery. So that is what we are talking about, data back recruitment and posting of specialists, which we are able to do through this data that is generated through health and wellness center. Sir, finally, sir, what I would like to repeat is the same point which Prithviraj ji has already told, sir. Health and wellness center is a very good infrastructure at the village level, which has reduced the out-of-pocket expenses, improved NCD management, improved quality wellness activities, and quality service delivery. Further, there is also an opportunity for the entire district administration to use this health and wellness infrastructure to deliver better services, to train the personnel better, to reduce the dependency on tertiary hospitals, to monitor our schools and Anganwadi centers much better. And that is what we are focusing on, sir. And we will keep on strengthening this area. Along with this, we will also continuously monitor our SDG indicators, Sustainable Development Goals, which we can better monitor if it is done at the village level rather than mandal and district levels. So this is what we are working on still, sir, and this is what we have worked till date, sir. We hope to ensure that the comprehensive healthcare, it is truly realized, sir, and we become more of a wellness center, and we ensure that most of the diseases are prevented at the right time, and the intervention is also done at the right time. So this is from Anakapali district, sir. Thank you very much, sir.
Thank you so much, Raviji. And both the officers, Prithviraj ji and Ravi ji, has given wonderful presentation. Their efforts to improve the services of health and wellness center, and especially this concept of family physician concept, that is really very impressive, and that is going to be very effective, especially rural population. So now I would like to invite our officers for any question. So Sarita ma'am, you want to ask?
First of all, I would like to compliment both the speakers for such a great initiative, that too especially in case of health, because health is I think the very vital importance, and it should be the first priority of any government or for any public authority for that matter. My question is to Ravi ji. I know it's very difficult to bring such an initiative, that too in Anakapalli. Eventually, I had been there 2-3 times, and I know how remote and far area this is. My question is just a curiosity kind of thing. As you said that Anakapalli is not having availability of doctors as per global benchmark, to 1 doctor for 2,000 patients. So I just want to know more about that in the present initiative, what were the steps taken to just bring at par this problem? And second is that if I'm right, please correct me if I'm wrong, that 58% of women and child were anemic and in the area. But we could see that 2% you were able to come out of that problem. And anemia, as we all know, that it's a very big problem in the country, and government is taking all out efforts to bring more and more women and children particularly out of this problem. And just one more thing I want to know, what kind of devices or what kind of steps are being taken to measure the anemic percentage? Because I heard that government is promoting hemoglobinometer as a care of device. Do you really use in the district? Thank you.
Ma'am, regarding the first question, ma'am, when we actually we have a lot of support from the central and state government both. So because of that, the first challenge we could address, and now every PHC, earlier we had only one doctor, ma'am. Now we have 2 doctors per PHC. And along with that, we also have a reserve of 6 MBBS doctors, and we have a good number of specialist doctors. So this was solved not only by the district administration, ma'am, a lot of support has been given by both central and state governments for us to solve this problem. So we could, but what role we played is, how do we do the recruitment on time? How do we place and post the doctors on time? So that is where we role, and the follow-up obviously with the state government. So that is one area where we worked on, but a lot of support in this case was given by central and state government, ma'am. So that is how we solved the first problem. And now we have, we can proudly say that we have a very sufficient number of doctors. Still we are working on some specialists, ma'am, and that is an area, because as you know, ma'am, getting specialists to rural areas is a big challenge, and we are still working on that area. But MBBS doctors we have solved to a great extent. Ma'am, the second problem which is quite big in Anakapalli especially, ma'am, is anemia. Anemia we have divided it into 2 parts, ma'am. The pregnant and lactating women, basically pregnant women, and the 10 to 19 years adolescent girls, ma'am. So pregnant women monitoring we are doing differently. 10 to 19 years monitoring we are doing it differently, ma'am. So how this is being monitored? So my figure as of today, we could drastically improve the pregnant and lactating women anemia percentage. Why this could happen is because our focus for the last 1 year was extremely high on that area. We have used the services of Anganwadi centers. We have used the services of CSW, and we have collected a lot of data, which is sub-center wise, health and wellness center wise. And then we have narrowed down on those areas where it requires more targeting. For example, I'll tell you, ma'am, I have a 12-kilometer stretch where the anemia percentage was very skewed compared to the other parts of the district. So we deployed a lot of focus on that 12-kilometer stretch. So this was done after analyzing the data a lot. And then we could ensure that we introduced a concept called as Mission 12, where we want the anemia percentage to, the hemoglobin percentage to be about 12. And how do we do that is proper food, IFA tablets, counseling, hygiene activities. That is a regular follow-up we did. But more important point was, how do we map each and every area, and how do we do the follow-up? So that monitoring was very detailed for pregnant and lactating. The second thing is 10 to 19 years. This part, this area still our anemic adolescent percentage is very high. And that the reason behind that is a little lack of monitoring at the school level. So this initially we could solve only 2%, ma'am, but now we have appointed health ambassador at each and every school. And as you asked, ma'am, we have using hemoglobin meters at each and every CHC, village health and village center. So we have a target of collecting the samples every 3 months and monitoring that. So every quarter we are getting data, and every quarter we can monitor the anemia percentage. So these 2 activities are helping us to solve the biggest anemia challenge, and this is one of our very important parameter in our review, ma'am. As I told in the presentation also, earlier we used to do PSC wise monitoring, but now we are taking the cross section of each and every health and wellness center, and who is underperforming, that is monitored in more detail and reviewed in more detail. Each and every CHO staff, each and every CHO, each and every ANM is trained how to take blood samples and test for anemia, and ensure how to do a proper follow-up and what are the measures that are to be taken. Every block development officer is tasked with their performance that has to be improved in a period of 3 months, ma'am. So this is a continuous activity. We have solved more or less the problem of pregnant women. We are now working closely on the adolescent girls. We are confident that in next 6 months we will solve that also.
Thank you.
Now, anyone from web room who wants to ask any question from any of the speaker? Okay, so now one question from my side. I want to just ask to Mr. Prithviraj. Prithviraj ji, you have told that you have put all infrastructure, logistic supports and manpower to run health and wellness center properly. What I have observed from my experience that the monitoring of these things is a big challenge, especially in rural areas. So what was your monitoring system when you were posted there, and whether the monitoring system which you have placed in place at that time when you were posted there, whether that is still effective after your transfer, or is there any change?
Yes, sir. Yes, sir. Sir, one is there is a regular monitoring system in government. You have the taluka level health officers, then you have the district level health officers, then the collector and all. So one that is already in place. Sir, one thing, if we notice, there is a concept of Jan Arogya Samiti for the health and wellness centers. So it involves the sarpanch, it involves the local public representatives at the village level. So Jan Arogya Samiti का सर हम लोगों ने ट्रेनिंग भी लिया था, हमने उन्हें बताया था कि आपका ये अधिकार है, आपकी ये समिति का ये काम है कि आपको लोकल लेवल पे जाके चेक करना है लोगों की अगर ग्रीवेंस है कि डॉक्टर वहाँ है, अवेलेबल है या नहीं है, मेडिसिन मिल रही हैं या नहीं मिल रही हैं। तो सर वो एक जन आरोग्य समिति को थोड़ा हमने सशक्तिकरण करने के लिए एक थोड़ा सा एक्स्ट्रा स्टेप लिया था। रिगार्डिंग दी सस्टेनेबिलिटी सर, एक बार मुझे लगता है कि सर लोगों को पता चलता है उनका अधिकार क्या है, उनके राइट्स क्या हैं, तो sir, it continues. So we had an informal WhatsApp group of these सरपंचेस जो जन आरोग्य समिति के हेड थे, तो उसमें वो लोग शेयर करते रहते थे कि आज हमने यहाँ ये ऑब्जर्व किया, आज हमने कुछ योगा एक्टिविटीज लिया, आज हमने ये लिया। तो सर माय लिमिटेड पॉइंट इज अपार्ट फ्रॉम द गवर्नमेंट मॉनिटरिंग सिस्टम, वी इन्वॉल्व द public representatives and the people at the village level, which I believe is a sustainable way and also more effective way of monitoring, sir.
Thank you so much. Now I request my colleague, Mr. Udayji, for formal vote of thanks.
Good afternoon to one and all. First, I would like to convey my heartfelt thanks to Sri S.K. Pandey, Director DRPG, our lead speakers, Sri Prithviraj, Sri Ravi for wonderful talk and presentation, and wish you a very much successful and bright future ahead. All AR secretaries of the states, health secretaries of the states, mission directors of National Health Mission, all district collectors, all CTI, all ATI for their active participations, my colleagues from DRPG, my colleague from the NCGG for arranging all this wonderful, successful and wonderful completion of this event. And thanks all. Have a nice day.
Thank you so much. Thank you.
Thank you.
Now we can close.